speech on lupus. This subject is very dear to me because my sister lives with this disease every single day. Lupus, in definition, is known as a chronic inflammatory disease. It is classified as an autoimmune disease. Effects of lupus. Affects the immune system to create autoantibodies which attack and destroy healthy body tissue. Inflammation caused by lupus affects many parts of the body, like joints, skin, kidneys, blood cells, heart, and the lungs. Main risk factors of lupus. They are heredity, sex, race, age, and long-term prescription drug use. Types of lupus. There are 4 different types of lupus. The first one is systemic lupus erythematosus, also known as SLE. Chronic cutaneous lupus, also known as discoid lupus. Drug-induced lupus, and neonatal lupus. Systemic lupus erythematosus is the most serious form of lupus. Usually affects vital organs like the brain, lungs, heart, and the kidneys. Chronic cutaneous lupus. This type of lupus has 5 subregions. Type 1 of chronic cutaneous lupus. Hypertrophic and verrucous DLE. Verrucous is classified by thickened lesions, and hypertrophic is classified as wart-like lesions. Type 2 of chronic cutaneous lupus. Lupus profundus, which is classified as firm lumps in the fatty tissue directly beneath the skin. Type 3 of chronic cutaneous lupus. It is mucosal DLE, which is classified as lesions in the mucous membranes of the nose and the mouth. Type 4 of chronic cutaneous lupus. It is palmar and plantar DLE. It is classified as lesions that show up on the hands and the feet. Type 5 of chronic cutaneous lupus. Subacute cutaneous LE. Classified by extremely photosensitive papules. Okay, here we see a picture of mucosal DLE. The picture of inside the mouth. You see the gums and the lesions in there. Okay, here we have lupus profundus, and here are lesions on someone's gluteus maximus. Hypertrophic and verrucous DLE. Here we see an elbow and the side of the head.
Oh my gosh.
Here we have palmar and plantar DLE. We see a hand and a foot, and they're both seriously affected. Subacute cutaneous LE. Here we see someone's back and someone's arm. These are extremely photosensitive papules. Drug-induced lupus. This is caused by medications that trigger lupus. Common medications that trigger this problem are procainamide and minocycline. Now this type most likely affects men rather than women. Neonatal lupus. The condition is contracted from the passage of maternal autoantibodies. It can be recognized in the uterus from 18 to 24 weeks. Common signs are rash around the baby's eyes and heart block. Symptoms of lupus. It's important to know that many different symptoms of lupus exist, but not everyone has all of them. The most common are achy joints, fever of more than 100 degrees Fahrenheit, arthritis, prolonged fatigue, skin rashes, anemia, chest pains, blood clotting issues, hair loss, seizures, muscle inflammation, easy bruising, malar rash, and Raynaud's phenomenon. Now here we see a picture of the malar rash, also known as the butterfly rash, affecting this woman. Diagnosis of lupus. There is no single test that diagnoses lupus, but the most major things that affect people are malar and discoid rashes, and this really aids in diagnosis because it's one of the most common symptoms. Treatment of lupus. Patients are advised to stay out of sunlight, and there are many medications to treat lupus, but it's important to know that these medications just mask lupus, and there is actually no cure for lupus. Thank you.
Yay!